Alrighty, we are with Chad Jackovich, the founder of Pure Benefits of Michigan. Chad, could you tell us a bit about yourself and what exactly Pure Benefits is and what you do with it?
Yeah, Pure Benefits of Michigan is a health benefits firm. We work with employer groups of all sizes. So your large employer groups, that could be, a couple hundred employees to 1,000+ employees looking for, better benefits and sustainability in their health plans and driving costs down. And we could be looking at alternative solutions with the middle groups and small employer groups where maybe costs have just gotten out of control and maybe some of the rates that they're getting year after year just are not sustainable for them to absorb on an annual basis. So we really try to work with employers of all sizes for sure, meet them where they're at, and then deliver solutions that they can take advantage of to improve their cost, their bottom line, and their benefits at the same time.
And so what would you say is the biggest hurdle or barrier for employers when it comes to healthcare plans for themselves and their employees?
I mean, the biggest burden that they're running across certainly is trying to drive cost containment solutions. They're out there, but in the traditional sense, they're always getting rate increases year after year. So someone's having to absorb that cost. So whether it's the employer themselves or the employees, if the employer turns it over for the employees to absorb in payroll deductions, or it can even be absorbed through the plan. And what I mean by that is usually when the health plan absorbs that increase or that cost on an annual basis, you're deteriorating the health plan. So you're offsetting that with higher cost share amounts that the employees would have to pay for. So it gets employers and employees in a worse position typically every year, because then they're truly deciding on, are they going to go get groceries? Are they going to pay their bills? Or are they going to go in and get treated for maybe the health care that they need? And they know that maybe the deductible is really high and they can't afford that. So it puts everyone in a worse position and a tougher position to make those decisions. And usually what happens is it's delayed care until it's an ER visit or urgent care visit, and it could be a much more costly event.
For sure. And then, so how does WoW Health Solutions as a direct pay marketplace compare to traditional healthcare options for employers?
The first couple things that come to mind when I think of WoW Health benefits versus traditional is what I love as a benefit advisor is you're not just providing a solution for maybe just those employees that are working 30+ hours, that are considered full-time, right? We have benefits that we can deliver to employer groups for part-time employees that might not have benefits. So they're getting something. And a lot of times the cost is reasonable enough to where an employer can pay for it. So literally zero deductions coming out of payroll for the employees. They're getting a bigger check, right? It's not being deducted. So they get to take that home and pay for the bills and whatever else they need for that month. Also, a big one is it caps on the cost on each need, whether it's an injury, accident, or illness. That is completely different than traditional health insurance, because usually you pay your deductible first, co-pays and co-insurance, and all that funnels towards that annual out-of-pocket max that employees have to pay for. That's all their cost share amount. Well, imagine that only being $1,000 or $2,500 for that event. And it can also carry over to the next year in some cases. So I would say more opportunity for your employees and your population, providing more benefits for them, not just the full-timers, cost-friendly, and obviously reducing risk and liability with the employee's cost share. It's all win-win for an employer and an employee.
Yeah, definitely sounds like it. And so What would you say the price point difference is between a traditional benefits plan and using a direct pay marketplace such as WoW?
It would be hard because I mean, there's definitely savings there, right? Because we wouldn't be looking at the opportunity or alternative solution of WoW benefits if it wasn't there, most likely. So price plays a key part. There's no doubt about it. But I'll say this, the, and single contract, the savings is certainly going to be there for all your employees. Two person, you're going to continue to drive the savings up. And then of course, as you get to a contract of, two or more, like a family contract, you're going to see significant savings on a plan versus traditional health insurance. So for employees and employers thinking about these benefits, even if you wanted to just go out and get the benefits yourself and you weren't even working with an employer, this would be a viable option for you to consider. And so the savings, it's hard to put it in a percentage because there is a range, but the savings are there. They're significant. So it's definitely worth a look.
Gotcha. And then just one last question that kind of popped up while we are doing this. Are there specific types of employers, whether that is based on company size or industry type, that sort of thing, that would benefit from using WoW? Or do you think that WoW is pretty much like universally applicable across industry, employer size, employees?
So it's for all market sizes. It really is. I think it's easier to maybe deliver that message to small employer groups. First off, they don't have to offer benefits, right? But they want to retain and recruit their talent. So they want to provide something. And that's a good way to maybe check that box. Um, I, I'll just say that I think it's the biggest thing with WoW health benefits is that with any plan change, I don't care what you're delivering as far as the solution set that year, what it really comes down to is communication and education. And if you can execute those two things, it truly is a viable option for all market sizes. But you got to get that right. And I say this all the time. One of the biggest things I also love about WoW Health Benefits is they have an app that you download. And so you literally have all the information that you need in the palm of your hand. And that is so important when you need healthcare because you usually do not feel well. You're sick, you're tired, you're not quite your best. You're not going to remember where that benefit guide is that you left in, a cabinet. But if you have an app on your phone, you know where to call the nurse navigation line that can be helpful to you to redirect you for healthcare and get you to a nearby clinic or an urgent care or ER. Of course, you might even know where that's at, but they're there to help kind of direct you. And so I think that's the biggest thing is being able to have a tool like that is very resourceful, has all the numbers right there for you, and you don't have to remember anything.
Amazing. I didn't even know that. So is there anything else that you want to touch on or share more about?
No, I would just I think everyone deserves it to themselves to give it a look for not only your bottom line and what you can maybe help achieve with your um employees. And look, it may not be for everybody, and we get that. That's why we look at several different avenues and solutions. However, just because it may not be a viable option for the few, there's ways you can work around that, and you can offer different solutions within WoW without providing a WoW health benefit, like setting up an ICHRA, which is an individual account health reimbursement and individual coverage health reimbursement account, I should say, that they could take advantage of if they need to. But that's not always the case, and usually it is a great fit for many people. So.
Amazing. Well, thank you so much, Chad, for sharing your insight and your experience with this sort of thing.
Yeah, yeah, yeah. You're welcome. Thank you for the time.
Of course.